Okay, so lastly for the upper extremity, we're gonna look at the hand. So we're gonna do the walking on your hands trail. So what we'll do is we'll orient ourselves. We're gonna start with the ulnar side first, and then we'll move radial. So on the ulnar side, remember distally you have the head of the ulna, and then you have the styloid process of the ulna. If you fall just off of the styloid process of the ulna, you're gonna land on what we call the triquetrum. Now you can radially and ulnarly deviate, and it will pop in and then out of palpation with that motion. Next, what you're going to do is you're going to flip the hand over so that it's in a supinated position. You're going to fall again just distal off of the ulna, and that first little bump that you feel is called the pisiform. Now you're going to take the pad of your finger, you're going to point it towards the index finger of your patient, and you're gonna press down. That mound is the hamate. Now if you scoop kind of back and laterally, you can appreciate the hook of the hamate. It's very close to the pisiform as well. And anatomically, that becomes important when we're talking about Guillen's canal or tunnel. Let's go ahead and move to the radial side next. So we have the head of the radius and the radial styloid process. If we fall just distal to that, that is where our scaphoid or scaphoid is located. You can place your partner's forearm in a neutral position and ask them to extend their thumb. This forms the anatomic snuff box, and our scaphoid lies at the base of that. Go ahead and relax your thumb. You can also ulnarly and radially deviate, and it will come into and out of palpation with that as well. So then just distal to the scaphoid is what we call the trapezium or trapezithumb to help you remember. That lies just distal to the first CMC joint. So a way that you can confirm if you're there is, again, you can have your partner flex and extend their thumb. Good? So if your thumb is too high, then when they flex and extend, they're just gonna move with the metacarpal. So that's how you know if you're too far. You wanna come just distal to where you can feel the articulation of the joint, but that where your thumb's not moving with their thumb. So go ahead and do that one more time. Good. Okay, so then we're gonna move on to your lunate and your capitate. So for that, you gotta remember Lister's tubercle as your reference point, which is on the dorsal aspect of the radius. You're gonna take that and you're gonna draw an imaginary line to where the third metacarpal ends. This region is where the capitate and the lunate live. So lunate, proximal row, capitate, distal row. You're gonna fall just distally into a groove. And then you're gonna ask your partner to flex and extend their wrist. When it flexes, the lunate will pop into your thumb in the proximal row. Then you're gonna come just distally and do the same thing, and then the capitate will follow and pop right into your thumb with wrist flexion. Finally, we've got your metacarpals and your phalanges. It's easiest to start at the metacarpal head and walk your way down for each. You can do the same thing with the phalanges, and then you can also palpate the joint and then appreciate the articulation at each IP joint.